Hello, everybody. Welcome to the Mental Health Minute by Elite DNA. I'm Phil Cirrone, the Chief Operating Officer at Elite DNA, with my host, Dr. Sharon Bloom, the Chief Clinical Officer. Good morning, Dr. Bloom.
Hi, good morning, Phil. Today's show is about a different treatment for depression newly offered by our psychiatry department called Spravato.
And to help talk about that today, we have our Chief Medical Officer, Dr. Omar Ritchie, who is a dual board-certified psychiatrist in child and adolescent and general. Good morning, Dr. Ritchie. How are you?
Good morning. Nice to be here.
So, Dr. Ritchie, if you can kind of just explain to even myself and everyone watching, what is Spravato and how does it work?
So Spravato is the brand name for esketamine. Ketamine is an anesthetic that has been shown to be very, very effective for treatment-resistant depression. So there's been some studies for a long time and some treatments, off-label treatments. When I say off-label, I mean FDA approved or not approved. Off-label means that it's not approved yet. There hasn't been enough studies until the FDA has given approval. So Spravato turns out to be the first brand that's a nasal spray format of this anesthetic that is given in a sub-anesthetic level, therapeutic level, as a treatment option for depression. Spravato works differently than other antidepressants. For example, when we look at all the oral antidepressants that individuals take that are out there, Prozac, Zoloft, Paxil, Effexor, and so many of them, they usually work on different neurotransmitters in the brain. Spravato itself works on a very different receptor. It's called N-methyl D-aspartate, which is called NMDA. And NMDA is a receptor for glutamate mainly, but it has a role in the brain to turn on and turn off areas that have to do with neuroexcitation. And in doing so, it may help down the line in certain areas of the brain that have to do with modulation of mood. Now, we really don't know how Spravato exactly works, but we know it works in a very different way than all those antidepressants. And because of that, and because it's shown such a significant improvement in patients in a short period of time as far as response to treatment and feeling better with low side effect profiles, the FDA approved it about a year and a half ago, and we are offering it here in our clinic, and it's a nasal spray that the person comes in and it is administered under the supervision of the healthcare provider. And the reason that it's done in that way is because you have to be monitored for 2 hours. So you come to the clinic, come for your appointment, you're prepared beforehand about what to expect, and you're actually taught how to use the nasal spray, and you self-administer the nasal spray, and then you're monitored for 2 hours, and we're monitoring blood pressure and making sure there's not over-sedation or the person doesn't become too dissociated. There are some side effects that I could talk about, but obviously, like all medications, we want to be cautious and safe. This is a medication that once you use it that day, at 2 hours afterwards, you leave the clinic, you are not to drive, so you'll have to have someone drive you to and from the clinic and not use heavy machinery. Really, you're supposed to have a restful day the rest of the day until you sleep. The next day, you're back to yourself. But most individuals that we see really have a very good response as far as not having any side effects.
And so, Dr. Ritchie, who exactly would be a good candidate for Spravato, and how would someone go about obtaining the service?
So Spravato is really for those individuals that have what we call treatment-resistant depression. Treatment-resistant depression is defined as a person that has had at least 2 or more oral antidepressants, and they're still having significant symptoms of depression. Now, Spravato is specifically for individuals that are already on oral antidepressant. So if you start Spravato, you would stay on your medication, and then the idea is that you're going to have a combination of treatments that are going to work. And usually it's someone that has had treatment but hasn't worked well enough.
And so for anybody who would be looking to get started on such treatment, they can reach out to us through our website, which is elitedna.us, or they can call us by phone at 223-2751 and find out if they are a good candidate for Spravato. And that's obviously a full process, Dr. Ritchie, in evaluating the patient and determining if they are appropriate RN. Is that correct?
Yeah, there's an initial consultation that we do to review the history and the previous treatments and to see if the person is a candidate. If the person does have an active or history of active substance abuse, that may be a problem because Spravato is in a controlled substance category, and individuals that take Spravato that have a history of substance use could have a relapse. So that's one of the warnings and one of the things that are contraindicated. But there are many people that have severe depression, along with anxiety, by the way, PTSD. You don't have to have just depression. But the Spravato and ketamine product itself has been shown to be very effective.
Yeah, it's amazing the amount of treatments now for major depressive disorder. And Dr. Rich, I'm so thankful that you joined us, but I would love to have you on again at some point to talk about another one of those products called TMS. So thank you so much for covering Spravato and educating us all. As always, Dr. Bloom, thank you for joining me, and I look forward to the next Mental Health Minute. Thank you both. Have a great day.